I wanted to talk about the growth hormone secretagogue peptides like samorelin, CJC1295, tesamorelin. Tesamorelin are actually FDA approved to treat lipodystrophy in HIV patients. They've made their way into the anti-aging community and also just people looking to improve body composition because they can really help with muscle recovery and sleep. Those are the main benefits that I really promote with them. And you do sleep very well on them. Vivid dreams is a potential side effect. That can be good, that can be bad. If they're good dreams, people report positive. I don't typically hear like nightmares, but all that to drive home is that you just sleep better on them. With the improved sleep and muscle recovery, the improved body composition can happen secondarily because you're able to work out more frequently with more intensity. I don't really say that it's going to change your body composition much if you don't have a solid workout regimen or are hitting your dietary nutritional goals, higher protein, staying in a calorie deficit, along those lines. But they can be a solid adjunct to your workout regimen in terms of muscle recovery and improved sleep quality. They're typically tolerated really well. Potential side effects can be mild water retention. With that water retention could come carpal tunnel-like syndromes or neuropathy pain in your hands. I've not had anybody complain of that, but that is a potential side effect that I just fully disclose. The main drawbacks is frequency of administration. These are administered as subcutaneous injections 5 nights a week. Sub-Q, injected in fatty tissue. If you take orally, they're peptides, so they're branch chains of amino acids. They typically just are dissolved by your stomach acid, and so they're not very viable. Taken orally, you inject 5 nights a week at night specifically because they work by getting your pituitary to pulse growth hormone a couple more times while you're sleeping. And also if you can take them fasted 90 minutes after your last calorie intake, you'll have even more of a response from them as you kind of get the benefits of the ghrelin release, which can also stimulate growth hormone production. We monitor IGF-1 levels and just normal hemoglobin A1C and glucose to make sure that you don't get insulin resistant while on them. That is largely if you're taking straight growth hormone like bodybuilders do and insulin resistant from their large amount of growth hormone. You don't typically see that with growth hormone secretagogues as they still have the natural feedback loop to prevent too much growth hormone release. Other things to disclose are that we don't have long-term human studies to show long-term safety outcomes when taking into kind of this anti-aging and body composition space. And typically I'll have people take a month or two off after several months of use to help prevent growth hormone receptor desensitization. But all that to say is that we have had people have really good success with them.